Today, healthcare workers across the country were the first to get the COVID-19 vaccination. Hundreds of vaccines are making their way to distribution centers in the coming days. Fox News senior correspondent Laura Ingle reports.
A possible turning point in the fight against COVID-19. Hospitals across the country administering Pfizer-BioNTech's coronavirus vaccine today, kicking off the largest vaccination project in U.S. history.
How heartbreaking things have been for all of us, and the long days, over 12-hour shifts, and then finally we're hopefully seeing a light at the end of the tunnel.
UPS and FedEx staggering their deliveries throughout the day to 145 distribution centers. The immunizations starting just hours after shipments arrived. Here in New York, healthcare workers on the front lines were among the first to roll up their sleeves.
I feel hopeful today, relieved.
More than 500 sites will receive their shipments in the coming days. Some 3 million doses are in this initial batch. Another 2.9 million will be rolled out shortly after to give people their second dose of the vaccine.
Less than a year, much less than a year. These vaccines have already been administered in Great Britain and Canada. They're now going to be administered here in the United States.
Pfizer taking just months to develop this vaccine. Health experts say despite the shortened timeline, they're confident it's safe.
I think we're going to slowly start to see people feel good and liberated, that they're sort of in the clear to be able to live a more normal life with the vaccine. And I think that's going to prompt more people to take it.
And another 500,000 doses will be kept in reserve to address any distribution issues. In New York, Laura Ingle, Fox News.
Governor DeSantis called today's delivery of vaccines a great day. The first batch of vaccines went to Tampa, Miami-Dade County, and 3 other areas with substantially high positivity rates. But getting the vaccine is just half the solution. Getting people to take them is the other. In our next half hour, we'll talk about how health officials plan to do that.